Hello everyone. Good evening. Am I audible, guys? Hello. Am I audible, everyone? Okay. So in today's disease crash course, we will have a quick look on chickenpox as well as smallpox. Okay. So that's an important topic, particularly when it comes to we will look at epidemiology and rash. Okay, epidemiology of chickenpox, rash of chickenpox, and also we will talk about vaccines and we will talk about the vaccine for chickenpox and smallpox. Only we have to compare the rash ticket, plus we have to management of congenital varicella, that we have to discuss in this class. Okay, so it's a short class, but then it's again an important one. So let us start discussing about it. Okay. So the first thing, like I said, chickenpox is also varicella. About the epidemiology, so far we have discussed measles and rubella. Those who have missed on those lectures, you can look at the previous ones. Okay. We'll also be discussing some MCQs from this particular topic. Good afternoon. Okay. All right. So what is the causative agent? You can write with me if you want. It is varicella, right? Zoster virus. Okay. Varicella zoster virus, which is human alpha herpes virus. Okay. So this is HHV. All right. HHV what? 3. Okay. So I'll write the full name for it. Human alpha herpes virus. Okay, so this is HHV3. Is it clear? Incubation period kya hai? Incubation period is 14 to 16 days. Can anyone tell me what was the incubation period of measles, guys? What was the incubation period of measles? If you remember, we have studied measles का incubation period क्या था? 10 to 14 days. All right. And what was the incubation period of rubella? If you remember, we had studied 14 to 21 days. And what is the incubation period of chickenpox? It is 14 to 16 days. This is also a PYQ. Source of infection again is the case, ठीक है? Plus there is person to person contact, all right? Person to person contact. Then it can also spread via oropharyngeal secretions, okay? It can spread via oropharyngeal secretions and also lesions of skin and mucosa. ठीक है, lesions of skin and mucosa. ठीक है, so that is what is the mode of contact. Remember that. All right, these are all important questions. What about mode of transmission? It is both droplet and droplet nuclei. I'll tell you the difference between droplet and droplet nuclei. Although we have discussed in the measles class also, droplet are heavier particles more than 5 microns. So they fall down under the influence of gravity and travel for a distance less than 1 meter. Droplet nuclei are lighter particles less than 5 micron. So what happens? They remain suspended in air. Then do you see vertical transmission also? Do you see vertical transmission in chickenpox? Yes. So we definitely see vertical transmission. And what does this lead to? Vertical transmission भी हमें देखने को मिलता है leading to congenital varicella. So we will be discussing that as well. All right. Next, period of communicability is important. This is a PYQ. It is 1 to 2 days before to 4 to 5 days after appearance of rash. Okay, after appearance of rash. All right, 1 to 2 days before to 4 to 5 days after appearance of rash. That is the period of communicability, which is important. Okay. Next, what about the secondary attack rate? Secondary attack rate tells us about the communicability of chickenpox. So here, this is 90%. This is a PYQ. What about measles? What is the secondary attack rate of measles, everybody? So secondary attack rate of measles is 80%, but of chickenpox it is 90%. And what is the most common late complication of measles? We know it is shingles. Very good. Very good, everybody. Okay, what is the late complication? Most common late complication of chickenpox is shingles, which can occur due to reactivation of the virus years later after the initial episode. And why is it that someone who gets an attack of chickenpox presents with varicella zoster later? There is a fall in cell-mediated immunity leading to reactivation of the virus in 10 to 30% of the cases, resulting in herpes zoster. Okay, it happens in only 10 to 30%. So this can come as an expected MCQ. Okay, reactivation of the virus कितने लोगों में हो रहा है? In 10 to 30% of cases, resulting in zoster. Plus, the most rapid and sensitive means of diagnosis is examination of vesicle, but the best way to diagnose, you can diagnose it from the rash. Congenital varicella, again, it is threatening. Okay, when it is threatening, if it is transmitted in which trimester? If transmitted in which trimester? If transmitted in anybody? First trimester, just like rubella. Okay, first trimester of pregnancy. All right, that is important. Okay. So these are some important points of varicella, okay, chickenpox, which you must remember. Let's have a look at this again. Causative agent, HHV3, incubation period याद रखना है 14 to 16 days, source of infection ठीक है, mode of transmission भी ठीक है, period of communicability is important, secondary attack rate is important. Okay, so this was the small summary of chickenpox that we have discussed. All right. Okay. Okay, let's proceed forward. Now, what about the clinical features, guys? What about the clinical features for chickenpox? Okay, so if you talk about the clinical features, everybody, you will see that you have just like measles, you have a pre-eruptive phase, sudden onset of mild to moderate fever, back pain, shivering, malaise. That's okay. But what is more important? What is more important? More important is the eruptive phase. And in the eruptive phase, everybody, what do we have? In the eruptive phase, guys, what is most important about chickenpox? The rash. So can anyone tell me some features or points about the rash of chickenpox? How does it look like? What do you know about the rash of chickenpox? I'll be showing you the picture, but can you comment on some of the points about the rash of chickenpox? Anybody? Yeah, something that you remember, pleomorphic. Okay, I'll just be writing the points, what you're saying. Pleomorphism, very good. Anything else that you know about the rash? Centripetal, good Deepti. So let's write centripetal. Anything else that you know? Vesicles, okay. What about whether is it superficial or is it deep-seated? So I think this is superficial, yes. Then is it unilocular? Is it multilocular? All right, so yeah, rose petal appearance, dew drop on a rose petal appearance, ठीक है? Dew drop on rose petal, very good. Dew drop on rose petal appearance, anything else that you remember? Dew drop on rose petal, okay, anything else? All right, so it is superficial, pleomorphisms in different stages of healing, okay? All right, centrifugal and smallpox, good guys. Okay, so let us look. Tell me, is A chickenpox or is B chickenpox? Which one is chickenpox? Image number A or image number B? Chickenpox का rash कौन सा है? A image है या B image है for chickenpox rash? Who's going to tell me? Is image A chickenpox or is image B chickenpox? Very good, Rakesh. So this one is chickenpox, okay? and this one over here, this is smallpox. ठीक है, ये तुम्हारा smallpox है. So if you just try to compare, all right, this is superficial, okay, and this is like deep seated. Then if you look at the rash over here, यहाँ पे देखो, there is area of inflammation. Can you see? There's area of inflammation around the rash. यहाँ पे क्या है? No area of inflammation. That is how you can differentiate. Okay. No area of inflammation around rash. Okay. Then this is centripetal, more towards the center. All right. This is centrifugal. If you see over here, you can see the rash of smallpox on the palms also, and on the soles also, on the legs also. Chicken pox, you rarely see the rash on the palms or the soles. Okay, here palms and soles are spared. Okay, palms and soles are spared. Okay, but here of course in smallpox, palms and soles, ठीक है, palms and soles, all right, they are involved. ठीक है, palms and soles उसमें spared है in chicken pox, here they are involved. So let's have a look at eruptive phase. Rash is the first sign in children which erupts on the day the fever starts. Okay. Rash is symmetrical. First appears on the trunk abundantly, then followed by the face, arms, and legs. Okay. Less abundant. In the arms and legs, it is less abundant. So it is centripetal. From the trunk, it starts in the trunk and goes. Mucosal surface and axilla are involved. Palms and soles are spared. Okay. Rash is a clear fluid vesicle and looks like a dew drop on a rose petal appearance. Centripetal, pleomorphic, all stages can be seen. Macule, papule, vesicle, सब आपको एक साथ दिख सकता है, ठीक है? With every new crop, eruption of fever. All right, fever rises. It's superficial, unilocular. Inflammation is present around the vesicles. Rapidly it evolves. Okay, there's a rapid evolution. And within how many days this scab forms, everybody? This scab forms after 4 to 7 days. Okay, once the scab forms, the patient is not at all infectious. Okay, we'll be comparing chicken pox and smallpox rash also. Smallpox, like we studied, is deep-seated, okay, is deep-seated, multilocular. All right, let me show you some points about smallpox rash. Centrifugal, non-pleomorphic, deep-seated, multilocular, no inflammation around the vesicles, affects extensor surfaces. Yes, chickenpox flexor surfaces, spares the axilla, but this affects the palms and the soles. Slow evolution and scab forms after 10 to 14 days. So this is about the smallpox rash as well as chickenpox rash. Okay. So let's make a table and you're going to tell me the points. This is the most important thing from this chapter. Chickenpox rash and smallpox rash. Chalo, let's compare and write the differences, everybody. Chickenpox rash kaisa hai and smallpox rash kaisa hai? Let's start with the differences. So this is superficial. What about this? This is deep seated. Chickenpox कैसे है? Unilocular. All right. What about smallpox, everybody? Smallpox is multilocular. Anything else? Centripetal. Trunk से extremities. This is centrifugal. More towards the extremities. Fourth, pleomorphism. All stages can be seen simultaneously. No pleomorphism. ठीक है? What else do you have to know about chickenpox rash and smallpox rash, guys? Anybody? Okay. Yeah, who wants to tell me any other point? Pleomorphism, no pleomorphism. Area of inflammation, very, very important. Okay. Area of inflammation around rash. ठीक है? और यहाँ पे क्या है? No area of inflammation around rash. All right. Next, Palms and soles spared. Here, palms and soles involved. Anything else that we are missing, everybody? These are the most important points that you have to know. Okay, yes, this affects the flexor surfaces. And what about smallpox rash? This affects the extensor surfaces. Axilla involved. यहाँ पे क्या है? Axilla spread. Is it clear, everybody? Will you remember the most important differences? How can you identify it from the area of inflammation? Area of inflammation around the rash is in chickenpox. No area of inflammation around the rash is in smallpox. Okay. Next. Now, can you tell me which one is chickenpox and which one is smallpox? A क्या है और B क्या है? बताओ. Which image is A? You can see all the palms involved, the soles involved, the legs involved. Less is in the trunk region, but here more is in the trunk and hardly any rash you can see on the legs. So what is image A, guys? Is it chickenpox or is it smallpox? Very good. No. Think again. Think again. I just told you palms and soles are spared in chickenpox. But look at the first image. What can you see? Think again. Med psycho. Okay. Think again. What can you see for this image A? Where is the rash more? It's more on the extremities. Very good. So A is smallpox. Isn't it centrifugal? Okay, it's more on the extremities and here it's more on the central part. So this is chicken pox. B तुम्हारा chicken pox है और A तुम्हारा क्या है? Smallpox. Is it clear, everybody? This image can very well come in your exams. You can see the palms and soles all are involved in smallpox. Okay, the legs are involved. So this is smallpox, centrifugal, and chickenpox is centripetal. It's more occurring in the trunk area. Okay, the palms and the soles all are spared. Okay, let's go to next complication with chickenpox. We'll just read it one. Newborn children whose mothers are not immune and patients, even children with leukemia. Any child with leukemia or anyone who's immunocompromised patient, including those on immunosuppressive drugs, can develop a severe form of chickenpox or shingles. This one is a PYQ, guys. What is Ray's syndrome? Ray's syndrome has been a potentially serious complication associated with clinical chickenpox involving those children who've been treated with aspirin. So all those children who suffer from chickenpox and are treated with aspirin, what can you see in them? Ray's syndrome. Okay? Varicella pneumonia is the most common complication in neonates, adults, and immune compromised. Okay? This was just important. Maternal varicella during pregnancy. This congenital varicella is more dangerous. Again, if it is transmitted in which trimester? The first trimester. Okay? So, cutaneous scars, limbs, microcephaly, low birth weight, cataract, microphthalmia, chorioretinitis, deafness, cerebrocortical atrophy. But again, more important, it's not that important for chickenpox. Congenital rubella syndrome is very, very important. Okay? Now, this chart I want all of you to focus. This is important. It can come in the form of a PYQ also. Okay? How do we diagnose and manage varicella in pneumonia in pregnancy? Very important. Okay? So, if a pregnant woman is got exposed to varicella, she comes in contact with someone who was suffering from chickenpox. Okay? So if she remembers that she had been infected earlier, well documented history of infection, reassure the patient that neither the baby nor the mother is at risk. Okay? But if she does not remember whether she had been infected with varicella earlier or not, chickenpox earlier or not, there is no documentation of natural infection. You have to obtain the varicella zoster IgG serology. If IgG is positive, it means past infection, so antibodies are there, reassure the patient. But if it is negative, if there are no IgG antibodies, you have to give prophylactic immunoglobulin or acyclovir or valacyclovir. If no infections develop, good. But if acute varicella develops, if it's a mild illness, treat with oral acyclovir or valacyclovir. But if it's severe illness, you have to treat with IV acyclovir. To understand this chart, everybody, it is one of the important charts which can come in your exams, guys. All right, this is actually important, everybody. जो आ सकता है. Suppose there's a pregnant lady who's come in contact with someone who's had suffering from chickenpox. So you have to ask her, were you ever infected? If she was, okay. If no documentation, IgG का serology obtain करो. अगर positive आया, that means she has been infected in the past and she has protection from the antibodies. So reassure the patient. If it is negative, you can administer prophylaxis with immunoglobulin or acyclovir or valacyclovir. No infection develops, reassure. Acute varicella in mild illness, treat with oral acyclovir or valacyclovir, and serious illness may treat with IV acyclovir and evaluate the baby with ultrasound for any signs of infection, which we just saw. Is it clear? Thumbs up, everyone, if you understood this one point. This is very important. Algorithm for diagnosis and management of varicella in pregnancy. Okay, now here again I would like to tell you something, that if some woman acquires varicella in the first 2 trimesters, this presents in the form of congenital varicella. But if she acquires at any stage of pregnancy, particularly 3rd trimester, then congenital varicella का chance नहीं होता. हम लोग क्या बोलते हैं उसको? Maternal varicella pneumonia. And in case she acquired varicella 5 days, if antepartum period, within 5 days antepartum to 2 days postpartum, it is neonatal varicella. Remember, congenital varicella is a term which is given when the infection is acquired in the first or the second trimester. 3rd trimester में maternal varicella pneumonia, but antepartum का last 5 days and 2 days postpartum is neonatal varicella. Okay, all right. Now coming to the last part, chickenpox vaccine. Which type of vaccine is it? Live vaccine. Will you give it in a pregnant female? Will you give chickenpox vaccine in a pregnant female? No. Contraindicated in pregnancy. Why? Because it's a live vaccine. What is this strain? We all remember it is Oka strain, right? K for chickenpox. What about the dose, guys? 0.5 ml subcutaneous. Okay, is it a part of our national immunization schedule? It is not a part of our NIS. But if parents want to give chickenpox vaccine, they can give it in a private clinic. Okay, so 0.5 ml subcutaneously and 2-dose schedule, 0.5 ml subcutaneous with an interval of either 6 weeks or 3 months. Okay. Yes, very good. With an interval of 6 weeks or 3 months, guys. Okay, this is important. It has to be given from when? It has to be given between 12 months to 12 years of age. 2 doses. All right. Adolescents and adults. See, in India, chickenpox can occur in 10 years also. Okay, for adolescent and adults more than 13 years also, 2 dose, 0.5 ml subcutaneous with an interval of 4 to 6 weeks. ठीक है, so 12 to 18 months में पहला डोज पड़ जाना चाहिए and 12 months to 12 years के बीच में तुम्हें 2 doses देने. But remember, this is not a part of national immunization schedule. It has to be taken in the private clinic. But then it can also be given in the form of a combination vaccine. What is this? This is measles, mumps, rubella, varicella. Okay, many private hospitals you will see are giving MMRV vaccine, okay, which is also administered between 1 year to 12 years or 9 months to 12 years, 2-dose schedule, 0.5 ml subcutaneous with an interval of 4 weeks. Either you can give chickenpox vaccine separately or as a combination of MMRV. Okay? These are just adverse reactions, tenderness, erythema, contraindication in person with neomycin allergy. This is a PYQ. अगर किसी को neomycin allergy है, कौन सा vaccine नहीं दोगे? Varicella vaccine. Avoid salicylate. Anybody who suffers from chickenpox, don't give aspirin or something to avoid Ray's syndrome. ठीक है? What about immunoglobulin? It can be given within 72 hours of exposure. Varicella zoster, immunoglobulin. Some question can come. All right, for the prevention of chickenpox in exposed individuals in whom any immunocompromised person suffering from HIV, immunosuppressive therapy, congenital cellular immunodeficiency, ठीक है, प्रेग्नेंट फीमेल्स को अगर देना है तो हमने अभी क्या पढ़ा था, इम्यूनोग्लोबुलिन देना है. Please don't give live vaccine in them. We can't give them. Neonates, early neonates who have been born to women who've been exposed to varicella, we can give immunoglobulin. ठीक है? Dose is 12.5 units per kg with a maximum of 625 units. Repeat dose in 3 weeks if high-risk patients remain exposed. Just remember, immunoglobulin has to be given within 72 hours of exposure. Okay? So for chickenpox, guys, most important is, most important for chickenpox is the rash and the vaccine. And how will you diagnose a case of congenital varicella? So what is the answer to this? Anybody, chickenpox is infective 2 days before, 2 days after, 2 days before, 5 days after, 4 days before, 4 days after, 4 days before and 5 days after. What is the answer? Good. 2 days before and 5 days after. These are all PYQ. Measles kya tha? 4 to 5 days before and 4 to 5 days after. All right. When did smallpox eradication happen? Smallpox is the only disease which has been eradicated. Wild poliovirus strains wild poliovirus strains 2 and 3 also have been eradicated, but so far disease जो eradicate हुआ है वो सिर्फ smallpox है. What is the answer to this one, guys? It was eradicated on 8th May 1980. Smallpox, if you know, I'll just tell you 1 or 2 points. It's caused by variola virus, not associated with lymphadenopathy. All this is not important. Secondary attack rate is less than chickenpox, but the problem was its mortality was high. Okay? So can you tell me answer to this? Smallpox eradication was successful due to all of the following reasons except why were we able to eradicate smallpox? And which is not the reason over here. Anybody can answer this? Subclinical cases did not transmit the disease. A highly effective vaccine was available. Infection provided lifelong immunity. Cross resistance existed with animal pox. Come on, what is the answer? Smallpox eradication was successful due to all. Why can we eradicate a disease, guys? When source of infection is the case, there are no subclinical cases, you have an effective vaccine, and if you get infected it provides lifelong immunity. Did you have any other source for smallpox, any animal pox or something? No. So this is the answer. Okay, all these three are the reasons why smallpox could be eradicated. Okay, but cross resistance, there was no cross resistance with any other virus. Okay. Secondary attack rate of chickenpox. This is important. This is also a PYQ. 50%, 60%, 90%, 40%. What is the secondary attack rate of chickenpox? We have just done it. 90%. Okay. Measles is 80%. And one more last question. Chickenpox vaccine is, again, this is a PYQ. Chickenpox vaccine is we all know it is a live vaccine which is contraindicated in pregnancy. Okay? So please, whenever you revise chickenpox, you have to look at the rash, you have to look at some of the small epidemiology, management and diagnosis of, varicella in pregnancy, and a few details about the vaccine. Okay, it's a short class because not many questions turn up from this topic, but yes, image-based MCQ of chickenpox and smallpox rash can definitely be asked. Okay. So that's it for today, guys. The previous links you can find in the description box for measles, rubella. We've also finished now chickenpox and smallpox, guys. And you can join my Telegram group PSM with Dr. Neha, where I put out daily quizzes at 10:30 p.m. for your preparation. Okay, and also all the links of the classes are put out on this channel. Okay, so that will really be helpful for all of you. Okay, very soon there's a roster which has been put out for all the diseases. You can follow that. And if you want to attend any class, any crash course, any long course for PSM, you can tune into my Unacademy profile where you can attend any PSM course as well. Okay. So thank you so much. Have a very good weekend. Look out for the links on this Telegram channel. Very soon I'll be coming up with another important disease which will help you in your preparation. Thank you so much.